This PowerPoint presentation for healthcare aides will introduce the new Intershift reporting form and process. Acknowledgement goes out to the working group who assisted in the development of this new form and process. Brenda Rose-Weeb, Care Team Manager at Lac du Bonnet and Sunnywood Personal Care Homes. Carlene Irvin, Clinical Resource Nurse at Kin Place, PCH in Oakbank. Wanda Hicks, Care Team Manager at Rosewood Lodge in Stonewall. Cynthia Sinclair, Personal Care Home Program Manager, and myself, Michelle Moreau's Personal Care Home Program Staff Development Coordinator. According to Safer Healthcare Now, one of the biggest contributing factors to 90% or more of clinical occurrences and critical incidents involving residents, patients, and clients is lack of and/or poor communication and teamwork. Our goal is to reduce duplication in charting while increase quantity and quality of information shared between shifts of healthcare staff. Overall, we want to improve communication and teamwork, all the while ensuring quality resident care and safety. The Intershift reporting tool is a way of communicating relevant and important time-sensitive resident assessment data to the next care providers on the following shift in a manner that is effective and efficient. The Intershift reporting tool is meant to enhance either verbal face-to-face report between healthcare staff or taped report that may be followed by a very brief touch base with the nurse for clarification of issues. The Intershift reporting tool helps the nurse and/or healthcare aide to provide specific resident data to the next care provider. In combination with interdisciplinary progress notes and/or flow sheets, the Intershift reporting tool helps provide the entire scope of assessment, intervention, and evaluation data. The Intershift reporting tool may be utilized in certain situations as evidence of communication sharing or lack thereof, in combination with IPNs or flow sheets, to complete an investigation or other type of situation where evidence may be required. For example, in the event of a critical incident or even occurrence. The Intershift reporting tool is not meant to replace documentation or charting on resident flow sheets. The Intershift reporting tool is not meant to be used as a worksheet that is discarded, but to be completed for all 3 shifts in a 24-hour period. The data, therefore, must be kept clear and legible. The Intershift reporting tool is not a permanent part of the resident chart. However, it will be maintained as evidence in a binder for a period of 3 months. The Intershift reporting tool is to be kept in a binder in date order as a communication reference tool. The most recent date will remain as the first page or the top page in the binder. Some sites will have more than one Intershift report page for a 24-hour period, depending on site size and number of nurses and healthcare aides on each unit. For example, if there are 2 nurses working on any given shift, along with 4 healthcare aides, there will be a total of 2 Intershift report forms for nurses and a total of 4 different Intershift reporting forms for healthcare aides. All sheets for the same 24-hour period will be stored together in the binder, preferably with the dates of each page stapled together. It is the role of the clinical team manager and clinical resource nurse and/or designate to ensure the Intershift reporting form binder is maintained properly and pertinent information is shared amongst healthcare staff at all times to ensure safe resident care practices and follow-through. This is the top of the page of your Intershift reporting form for healthcare aides. This section will help highlight any site safety concerns that you have identified during your shift. If there are no concerns, simply enter not applicable or N/A. This section is meant for point form notation only. For any urgent information that the nurse should be aware of regarding site safety concerns. Anything that is urgent and requires immediate attention should be brought to the attention of the nurse immediately for follow-up. This section shows the resident-specific area of the Intershift reporting form for the healthcare aides. Enter in point form all information that the nurse should be aware of regarding resident care and or changes in resident condition, including but not limited to skin changes, sudden illness, mobility changes, physical changes, mental status changes, bowel movements, including quality and quantity, especially if there are concerns or the resident is on a bowel regime, urine output, the color and quantity of urine, the last time the resident was turned or changed, and the resident's food intake, if any of these things are different from the resident's care plan or different from their normal. It is important to note that any urgent situations shall be reported to the nurse immediately for follow-up and not saved till the end of the shift. For example, this is not an all-inclusive list. Include falls, bleeding, injury, sudden change in behavior, decreased level of consciousness, etc. Sign in the appropriate column for the shift that you've worked. 1 hour prior to shift end, the healthcare aides will report to the nurse on shift all observations and data captured for their resident assignment. Anything that was not previously reported or considered urgent. This will include all pertinent flowsheet information and anything else that has arisen. Please note that it is the responsibility of the nurse to document concerns brought forward by the healthcare aide that require nursing attention or follow-up. The nurse will report the healthcare aide and nurse intershift reporting information to the next shift of healthcare providers to ensure adequate information is shared. Upon completion of this report, give your healthcare aide sheet to the nurse. The same sheet will be provided to the next shift for use. Upon completion of the 24-hour page, the night shift nurse will replace the sheet in the designated binder and ensure there are new pages available for the following shift of both nurses and healthcare aides. Random audits will occur to ensure that information entered on the Intershift reporting tool that requires additional documentation in the flow sheets is taking place. Please remember the Intershift reporting tool does not replace the necessity for excellent documentation and or follow-up or reporting. Implementation expectations include the Intershift reporting tool will be started at all Interlake Eastern Personal Care Home Program sites effective immediately. The feedback form for staff is to be completed and returned to the clinical team manager no later than October 31st for review. Audits will take place at all sites in December, February, and April in collaboration with staff development and site care team managers to ensure compliance. As required, additional education and support and/or performance management will occur to ensure resident safety and resident safe care is provided. Thank you for your time, and thank you for caring.